Hey everyone, and welcome to our deep dive this time on something maybe a bit different, something a little personal even.
Oh, yeah.
We're talking all about nose picking.
That's right. It's something we all do, but maybe don't talk about that often.
Exactly. And maybe you're thinking, okay, so what's the big deal? Everyone does it. But it turns out there's a lot more to this habit than meets the eye.
Definitely. We've got a bunch of research to dig into today from medical journals and even some insights from those who really know noses, ear, nose, and throat doctors, those otolaryngologists.
Wow, yeah, that is a mouthful.
It is. It is.
So just how common is nose picking, really?
Well, one study we found in the Curious Journal actually found that 91% of adults admit to picking their nose.
91%. Wow. So basically everyone listening right now has picked their nose at some point.
Pretty much, yeah. And, no judgment here. We all do it. But that statistic does make you wonder where exactly harmless habit ends and when things start to get a little risky.
Right, that's exactly what we're going to unpack today. All the good and the bad, and maybe even the ugly when it comes to nose picking.
Now, before we get into any of that, it is important to say that our noses are actually kind of designed to handle a bit of, let's say, exploration.
I like how you put that.
Yeah, those hairs and the mucus in our noses, they work as filters, right? They trap particles we don't want in our bodies. And, well, sometimes a little manual help is needed to get things moving.
Okay, so occasional nose picking, not a big deal.
Generally, no, but it's when it becomes excessive or really aggressive that we start to run into problems.
And speaking of the inside of our noses, you know how it all works. I was actually kind of fascinated by this YouTube video we have from the Institute of Human Anatomy.
Oh, yeah. It's amazing to see the inside of a nose, isn't it?
It really is. I had no idea it was so intricate.
There's a lot going on in there, and one of the key takeaways from that video is just how delicate the lining of our noses is, especially an area called Kiesselbach's plexus.
Kiesselbach's plexus. Okay, so that just sounds a little intense. What is that exactly?
It's basically a network of blood vessels located in the front part of the nasal septum, that wall that divides your nostrils.
Okay.
And because it's got so many blood vessels right there so close to the surface, it's very prone to bleeding if it gets irritated.
That explains why even a little scratch can cause such a big nosebleed.
Exactly, and that's why too much nose picking or picking too hard can cause problems. You can easily cause little tears in the lining of your nose, and that increases your risk of those nosebleeds and even infections.
So not only are we potentially putting germs from our fingers up our noses, but we're making it easier for other germs to get in too.
You got it. And this is even more important to keep in mind if you have dry nasal passages already, or if you're dealing with allergies or, a cold, anything that can make that lining even more sensitive.
Okay, so speaking of infections, one of the sources you sent was this case study from the Curious Journal that I have to say was a bit alarming.
Yeah, it was a pretty interesting case. It involved a 66-year-old woman who developed a bunch of serious infections, sepsis, meningitis, and endocarditis.
Whoa, okay, that's a lot at once.
It is, and what's even more interesting is that all these infections were linked to the same bacteria.
Really?
Yep, methicillin-sensitive Staphylococcus aureus, or MSSA.
Okay.
It's a fairly common bacteria, but not usually something that causes infections in those specific parts of the body.
So that's why they were looking for a common source for all these infections.
Exactly, and after a ton of tests and a thorough medical history, what they found.
I'm guessing it has something to do with nose picking.
You got it. Her chronic, intense nose picking was identified as the most likely cause of those infections.
Really? So her picking habit was actually a contributing factor to these serious health issues.
It seems so. They actually found the same strain of MSSA in her nose that they found in her blood and other infected areas.
Wow, so the bacteria from her nose basically traveled to other parts of her body.
That's what they think. Doctors believe that her nose picking was creating these little abrasions, those tiny cuts in her nasal lining, and that basically allowed the bacteria to get into her bloodstream and spread.
Okay, that is definitely a very clear example of how something that seems harmless can actually have pretty serious consequences.
For sure. And this case also brings up another important point, something called rhinotillexomania.
Rhino what?
Rhinotillexomania.
Wow, say that 5 times fast.
I know, it's a mouthful, right?
Yeah.
It's basically the medical term for compulsive nose picking. And like we saw in this case study, it can have some serious consequences.
So it's not just picking your nose every now and then. It's when it's this uncontrollable urge.
Right. And I know some people listening might be thinking, hold on, can picking your nose really lead to something as serious as dementia?
Honestly, that thought did cast my mind too, especially after reading that article from the Royal Australian College of General Practitioners, or RACGP.
Yeah, they highlighted a study that was done on mice.
On mice, okay.
Now, it's important to say that this was just an animal study, so more research is needed, especially in humans. But the findings were interesting.
Okay, what did they find?
Well, they were looking at a specific bacteria called Chlamydia pneumonia and its role in Alzheimer's disease.
I think I remember reading about that bacteria. Doesn't it cause respiratory infections?
Yeah, it's often linked to those. And what these researchers found was that when they introduced this bacteria into the noses of mice, it was able to travel to their brains pretty quickly.
Okay, so bacteria traveling to the brain, that definitely sounds concerning.
Definitely. And while the study didn't look directly at nose picking, it did suggest that damage to the nasal lining, like the kind of damage that can be caused by excessive picking, might make it easier for bacteria like chlamydia pneumonia to reach the brain.
So the theory is that picking your nose could actually create a pathway for these harmful bacteria to get into the brain.
That's the idea. And while more research is needed, it is something to think about.
Wow. Okay, I think I need a minute to process all of that. Maybe put down the nail clippers for now.
Probably a good idea. Let's take a break here and come back in a bit to talk about what we can all do to break this habit, if it's something we're concerned about.
Sounds good. I think we've all learned a lot already, and we're just getting started. Okay, so we've talked about some of the potential downsides of too much nose picking, but now let's switch gears and talk about solutions. What can someone actually do if they want to break this habit?
Well, I think the first thing to remember is that there's really no need to be embarrassed or ashamed about it. As we've seen, nose picking is super common, right?
Yeah.
It's really only when it starts to impact your health or well-being that it becomes something you need to address.
So where do we even begin?
Awareness is key. Just start paying attention to when and why you pick your nose. Are there certain situations or emotions that seem to trigger it? Is it stress, boredom, maybe just a subconscious habit?
Well, it makes sense. Figure out those triggers, and then you can find healthier ways to deal with them.
Exactly. So if you notice you tend to pick more when you're stressed, maybe explore some stress management techniques like exercise, deep breathing, spending time in nature.
Right.
And if boredom is the culprit, try keeping your hands busy with something else, a fidget toy or something that requires you to really focus.
Oh, yeah, and maybe put the phone down for a bit, too. I can definitely see how mindless scrolling could easily lead to some mindless picking.
Absolutely. Reducing screen time is always a good idea, both for your mental health and for breaking habits like this.
What about environmental factors? Things like dry air or allergies, those can definitely make me want to pick more, too.
For sure, creating a more nose-friendly environment can really make a difference, so using a humidifier to add some moisture to the air, especially during those dry winter months, can help. And if allergies are a problem, talk to your doctor about finding some effective treatments.
So we've got strategies for dealing with those triggers and making our noses a little happier. But what if that's not enough? What if the habit feels like it's just too ingrained?
Well, in those cases, behavioral therapies can be really helpful. Cognitive behavioral therapy, or CBT, is one that's often used to break unwanted habits.
CBT. Okay, remind me how that works exactly.
Basically, CBT helps you to identify and change negative thought patterns and behaviors. So in the context of nose picking, a therapist might help you to recognize those specific thoughts and feelings that lead to the urge to pick. And then you can work on developing new coping mechanisms.
So instead of just trying to suppress the urge, you're kind of rewiring your brain to respond differently.
Exactly. You're learning to interrupt those automatic thought patterns and replace them with healthier choices.
I'm curious, are there any physical reminders that people can use to help them avoid picking?
Yeah, actually, sometimes a simple tactic like wearing a bandage or even just a glove on the picking finger can act as a physical barrier and a reminder to avoid the behavior.
Like a built-in stop sign.
Exactly. It interrupts that automatic movement towards your nose and gives you a moment to pause and choose a different action.
Okay, so we've got managing triggers, creating a nose-friendly environment therapy. But what about any underlying medical conditions? Could those be contributing to the urge to pick?
Oh, absolutely. Sometimes nose picking is a symptom of something else that's going on. So, for example, if you have chronic dry nasal passages, it's only natural to want to pick and try to relieve that discomfort.
Right, it's like constantly scratching an itch you might not even realize you're doing it.
Exactly. So addressing those underlying issues, whether it's dryness allergies or even some anatomical issue, can make a huge difference in reducing that urge to pick.
So it's really about taking a holistic approach, looking at the whole picture, not just the symptom.
Exactly. And remember, there's no one-size-fits-all solution. It might take some trial and error to find what works best for you.
That's good to hear. It's not about being perfect, it's about making progress.
Right. And, something else that's often overlooked is the importance of self-compassion. So instead of beating yourself up for picking your nose, try to approach the habit with a little curiosity and kindness.
That sounds a lot more supportive.
It is. Just ask yourself, why am I feeling this urge to pick right now? Is it stress, boredom, a physical sensation? Understanding those underlying motivations can be so helpful in finding effective solutions.
So instead of judgment, we're choosing curiosity and self-compassion.
Exactly, because at the end of the day, we're all human. We all have our quirks. And this isn't about being perfect. It's about making choices that support our overall well-being.
This has been super helpful. Honestly, I'm already feeling more equipped to tackle this habit. But what about the damage that's already been done? Can our noses actually heal from, years of picking?
That's a great question. And the good news is our bodies are pretty amazing at healing, especially the lining of our noses. So if you stop picking and give it a chance to recover, it can definitely repair itself.
Okay, so there's hope. Even if we've been digging for treasure for years, our noses can bounce back.
Absolutely. The first step is to stop the picking, and we've already talked about ways to do that. Keeping the nasal passages moist can also help with healing, so using a saline spray or a humidifier can really make a difference.
It's like giving our noses a little spa treatment, a little hydration and TLC to help them recover.
Exactly. Now, it's important to keep in mind that even if you don't see any visible damage, all that nose picking can still disrupt the balance of your nasal microbiome.
You mentioned the nasal microbiome earlier. What is that exactly?
Well, you've probably heard of the gut microbiome, right? All those good bacteria that live in our intestines and help with digestion and immunity. Our noses actually have their own microbiome, too. It's this delicate ecosystem of bacteria that helps to protect us from harmful stuff.
I had no idea. So our noses are like little worlds of their own.
I like that. And when we pick our noses, we're not only potentially damaging the lining, but we're also introducing foreign bacteria from our fingers, which can really mess with that balance.
Like throwing a wrench into the whole system.
Exactly. And that's another reason why being mindful of our nose-picking habits is so important. We want to give our bodies the best chance to maintain that healthy balance.
Okay, so we've covered healing the microbiome mindfulness. What about our immune system? How does that fit into all of this?
That's a crucial part of the conversation. Our immune system is this complex network of cells and proteins that protect us from invaders like bacteria and viruses.
Like our body's own personal army.
Right, and one of the first lines of defense is actually the mucous membrane that lines our nasal passages. That mucus might seem gross sometimes, but it actually plays a vital role in trapping those invaders and preventing them from getting into our bodies.
Huh. I never thought of mucus as a defense mechanism before.
It really is. It's our body's natural filter system. And when we pick our noses, we're not only potentially damaging that membrane, but we're also giving those invaders a direct pathway in.
Not a good strategy. So we're basically weakening our defenses and letting the enemy in all at the same time.
Exactly. That's why it's so important to give our immune system the best chance to do its job.
This has been an incredible deep dive into the world of nose picking, from anatomy to bacteria to our immune system. I'm wondering, though, is there anything else we should be considering? Any final thoughts for our listener before we wrap up?
Yes, actually, there's one more piece of this puzzle I think is incredibly important. The connection between our physical and mental health.
The mind-body connection. I knew we couldn't have a deep dive without it.
It's so crucial. As we've been talking about nose picking, it's become clear that it's often more than just a mindless habit. It can be a sign of stress, anxiety, OCD, or even deeper emotional issues.
Right, we talked about how nose picking can be a coping mechanism, a way to deal with those uncomfortable feelings.
Exactly. And that's why it's so important to address those underlying emotional issues, not just the behavior itself.
So instead of just saying, stop picking your nose, we need to be asking, what's making you want to pick your nose in the first place?
I love that reframing it shifts the focus from shame and self-criticism to curiosity and self-compassion.
And from there, we can start exploring healthier, more effective ways to cope with those emotions.
Exactly. Maybe it's talking to a therapist or engaging in stress-reducing activities or finding new ways to manage boredom.
It's like we've stumbled upon a life lesson disguised as a nose-picking intervention.
I like that. It speaks to the interconnectedness of our physical and mental well-being.
Okay, so we've talked about nose picking as a potential sign of deeper emotional needs, but what about the habit itself? Are there any broader takeaways we can apply to other areas of our lives?
For sure. The strategies we discuss for breaking the nose-picking habit can really be applied to any habit you're trying to change, whether it's overeating, procrastination, or something else entirely.
So it's about understanding your triggers, finding healthier coping mechanisms, and being patient with yourself along the way.
Exactly. Change is a process, not a destination.
You know, another thing that really stood out to me was your discussion of the nasal microbiome. It's wild to think that even something as small as our nose has its own delicate ecosystem.
It really highlights the interconnectedness of all living things. We're not just individuals, we're walking, talking ecosystems.
And when we disrupt those ecosystems, whether it's through excessive nose picking or other unhealthy habits, we're ultimately disrupting our own balance and well-being.
That's a great point. It underscores the importance of making choices that support the health and harmony of our internal worlds.
This whole conversation has given me a whole new appreciation for the complexity of our bodies.
And for the power of curiosity. Who knew that a deep dive into nose picking would lead to such fascinating and far-reaching discussions?
It just goes to show that there's always something new to learn, even from the most unexpected places.
Absolutely. And that's what makes life so exciting, the constant opportunity for discovery and growth.
Well said. Well, I think we've officially reached the end of our nose-picking odyssey. I'm feeling informed, introspective, and maybe just a little bit more mindful of my own habits.
As you should be, and I hope our listeners feeling the same way.
Thanks for joining us on this unexpectedly profound deep dive. We'll see you next time, ready to explore another fascinating corner of the world around us.
Until then, stay curious.
After that deep dive, I have to say I'm looking at tissues a little differently now.
I know, right? It's amazing how much there is to learn about something we usually don't even think twice about.
Yeah, and speaking of learning something new, I was really fascinated by what you said about the connection between our physical and mental health. It seems like nose picking is always just a physical thing.
Right, it's not just about the picking itself, it's about understanding the why.
The why, exactly, and sometimes that why is a lot deeper than we might realize.
Absolutely. Those underlying emotions, whether it's stress or anxiety or boredom or something else entirely, they can really show up in some surprising ways. And nose picking is just one example.
It kind of makes you wonder how many other habits we have might be connected to something deeper.
That's a great question, and I think it speaks to the importance of being curious about ourselves and, approaching ourselves with compassion instead of judgment.
Yeah, because when we start digging a little deeper, we might find a lot more than we expected.
Exactly, and that can be really empowering because then we can actually start to address the root of the problem instead of just the symptom.
So if you're feeling the urge to pick your nose, maybe it's a good time to pause and ask yourself, what's really going on here? What need am I trying to meet with this behavior?
I love that. It takes the focus away from shame and self-criticism and puts it on curiosity and self-compassion.
And from there, you can start exploring healthier ways to cope with those emotions.
Right, maybe it's talking to a therapist or finding some stress-reducing activities or just finding new ways to manage boredom. There are lots of options.
It's like we've stumbled upon a life lesson disguised as a nose-picking intervention.
I like that analogy. And it really speaks to that mind-body connection, how interconnected our physical and mental well-being really are.
Okay, so we've talked about nose picking as a potential sign of some deeper needs, but what about the habit itself? Are there any takeaways we can apply to other areas of our lives?
Absolutely. Those strategies we talked about for breaking the nose-picking habit, they can really be applied to any habit you're trying to change, whether it's overeating or procrastination or anything else.
So it's about understanding your triggers, finding healthier ways to cope, and, being patient with yourself along the way.
Exactly. Change takes time.
Another thing that really stood out to me was your discussion of the nasal microbiome. It's pretty amazing to think that even something as small as our nose has its own little ecosystem.
It really highlights how interconnected everything is. We're not just individuals, we're these walking, talking ecosystem.
And when we disrupt those ecosystems, whether it's through excessive nose picking or other unhealthy habits, we're ultimately disrupting our own balance and well-being.
That's a great point. It really emphasizes how important it is to make choices that support that internal balance.
This whole conversation has really given me a new appreciation for how complex our bodies are.
Me too. And for the power of curiosity. Who knew that a deep dive into nose picking would lead to such interesting and far-reaching discussions?
It just goes to show that there's always something new to learn, even from the most unexpected places.
Absolutely. And that's what keeps things interesting, right? The constant opportunity for discovery and growth.
Well, I think that about wraps up our nose-picking odyssey. I'm feeling informed and maybe a little more mindful of my own habits.
I hope so. And I hope our listeners are feeling the same way.
So to sum it all up, nose-picking, it's normal, it's natural, but it's important to do it in moderation. Be mindful of your triggers, keep those nasal passages moist, and don't be afraid to reach out for help if you need it.
And remember, it's all about creating a healthy, balanced relationship with your nose.
Well said. Well, folks, that's all the time we have for today. Thanks for joining us on this fascinating deep dive.
It's been a pleasure. Until next time, stay curious.